So in this episode of Talking HealthTech, we're bringing you a session that was recorded at our Talking HealthTech Spring Summit at the end of 2022. Now, this session was supported by our gold sponsors 3M for the event, and we talk about a topic that's near and dear to my heart, which is how you successfully implement technology into a healthcare setting. So I'm moderating this session, which you'll hear in a second, and I'll introduce those speakers after the intro. But I'm hoping that you enjoy the vibe and the insights and the collaborative nature of this session and the previous summit sessions we've released in the last week or so as well. Now, if you're enjoying these summits and want to check out the full 12 sessions that we held at our spring summit at the end of last year, consider joining as a THT Plus member. Information is at talkinghealthtech.com/THT Plus. There's options for every stage of growth, whether you're a solo individual or a startup organization or a larger scale-up. All of our members get free access to attend our summits live and also access the full library of over 100 sessions we've recorded at previous virtual summits as well. Let's get stuck into it. Collaboration starts with the conversation, Team HealthTech. Let's make it happen. This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare. All right, before we jump into session 7 of the Spring Summit, big shout out to 3M, who are our wonderful gold sponsors for this event. They've been amazing supporters of Talking HealthTech and the community, and their contribution to these summits has always been top-notch. Make sure you visit their virtual booth in the expo section of this event if you're attending the summit live, or jump over to their Talking HealthTech directory listing to learn more and see some of the previous podcasts and summits that they have appeared in before as well. So here we go, on to the next session. The successful implementation of technology in healthcare relies on the users of the technology being given the support they need to onboard the new technology to unlock the value from their investment as soon as possible, while at the same time minimizing disruption to the user teams. This is session 7 of the Talking HealthTech Spring Summit, titled Enabling Faster Engagement of Technology with Adoption Teams. I'll be moderating this discussion with Karen Snee, Manager for Clinical Informatics and Operations at Sunshine Coast HHS. Joining Karen in the conversation is David Kim, Implementation and Adoption Lead at 3M. In the lead up to this discussion, we ran a flash poll with our LinkedIn followers and we asked, what is the best measure of a successful technology implementation in healthcare? Well, 56% of responders said the best measure is that efficiencies are gained. 36% of people said the best measure is that everyone's happier. 8% said as long as the services are not disrupted, then it's a success. And no one thought that cost containment was the best measure of a successful implementation. Let's get to the discussion and unpack it a little bit further. So there you go. It's all about the efficiencies and throw the costs out the window. Who needs a budget anyway? No, I don't think that's the lesson from that poll. But it's an interesting way to shape the conversation, because we've got with me, I'm moderating this discussion with David from 3M, as we mentioned, and Karen, and looking at adoption specifically. So I'm going to actually go to both of you to give a bit more context and talk to me a little bit more about what you do. And, this topic around technology adoption. David, we might start with yourself.
Yeah, sure. I run the implementation and adoption teams at 3M's Health Information Systems division. So pretty much what that means is I work with the project teams whenever the customer purchases the clinician speech tools, make sure that's set up properly. And I work really closely with the clinicians to make sure that the whole change management and the adoption pieces run smoothly.
Got it. Karen, what about yourself?
So I work in clinical informatics at the Sunshine Coast Health Service. We sit within health information. We sit under the broader portfolio of digital health and technology within the HHS. I manage a medium-sized team who looks after clinical information systems for the HHS. We provide system training, support and adoption, system and record maintenance, and anything from access through to separation we kind of manage. And we really, I suppose, a big part of our role is that relationship management management, and that's with the team, the multidisciplinary hospital staffing base, and vendors and contractors.
Yeah, I see. Keen to unpack that a little bit more too, because by the way, Sunny Coast represent. I'm sure we've got a few people within the chat that are there. I know I saw a couple in there actually. A couple of our THT Plus members are based up that way too. So, um, it's the new health tech hub for Australia. Anyway, let's not get sidetracked. But the point around adoption, because we know. I guess I'm more familiar with, say, David's role within this kind of health tech setting, where from a vendor side it's in their best interest that technology is adopted, although sometimes you see it kind of just chucked over the fence and away you go, you do what you like. But from your side, you're in the healthcare delivery side, and you're so focused on the adoption piece. Talk to me a bit more about that role, what you do, how you think about it.
Yeah. So I suppose I alluded to in my intro was, that client relationship management. A key part of what we need to do is understanding the client, who they are, how they use that technology, and how we can best support them through the implementation and then the adoption of those technology. So we're the central contacts for the clinical tech we manage. And we built relationships with our multidisciplinary teams to facilitate that adoption. We kind of need to think about a number of things, and I suppose some of those things are about, how savvy, how willing are our, individual clinicians and services in that tech space, and what we can do to understand, influence, and support their experience. We have to consider and juggle multiple things in that relationship to support the adoption. And I think some of that is around change management principles. We can't just put in a piece of tech and expect clinicians to adopt it. So we need to have a real understanding of what will improve the patient and client care, so clients being our clinicians, and also the workplace environment and our work processes and their work processes. So we're trying to provide that person or service-centered approach. We've got that intimate understanding of our clinicians, and also the technology that's being implemented. And we just need to understand what the impacts to that clinical base is and how we can assist with making it better. We've got to be really flexible in delivering the technology, because we have to kind of try and fit around those clinical schedules, because the clinicians do have, competing priorities. We also have to consider heavily the change fatigue that's been hitting the clinical space. I mean, clinicians are expected to adapt and embrace new technology quite rapidly in the current environment because of the technology that is coming through. So we always have to take that into consideration. And then we've just got to sell the benefits. And that can be difficult sometimes. We've tried a number of things. We always try to pilot technology first. Then we're doing road shows, offering that kind of at elbow support, trying to find champions and super users, anyone who might be sitting on the fence, try and get them on board so that they'll adopt and spread the word for us. But I suppose, we really do need to understand what are the long-term benefits to the individual, the patient, and the organisation, and I suppose ultimately ensure that we don't promise anything we can't deliver.
Yeah, all very true. Because I think about, look at the poll that we ran earlier. I guess they could be outcomes or goals for a particular project, and as Greg, rightly pointed out in the chat too, it's obviously you need to be clear from the outset what the purpose of a technology implementation might be, and quite often it's going to link back to better patient outcomes or the improving the process, the efficiency around that healthcare setting. But getting that buy-in is really important. And I can see Katrina in the chat has jumped on that point you made around change management principles as well. There's a few different models like the ADCAR, which I think I know a couple of those ones. I know that the K is silent. I remember that much. Acknowledge desire. There's a silent K, and then there's reinforcement at the end. There's other ones in there too. Katrina can let me know. I probably could have googled it as well. But look, I'd like to go to David on that one, because thinking about then for clinicians specifically, as a vendor, it's really important for you that clinicians, have that buy-in. That they're critical to technology implementation and ongoing use. What are some of the important things that you consider when you're, putting some of these projects into to get that buy-in with clinicians?
Yeah, when it comes to clinicians buying, I think it mainly has to do with winning a game of hearts and minds. In many cases, when the decision to purchase these speech technology tools is made, it's typically made with a really small group of executives or clinicians. So when the time comes for change and implementation and the go live, this massive change in how the clinicians work is a big change for them. So that can lead to a lot of frustration, which it typically does. So you tend to hear things like, this doesn't work for our department, or we do things differently in this department, which is a very valid point. So I think we need to get the clinicians involved from the very beginning, especially when this whole discussion is kind of being made, just so that they feel like, especially with all these different departments that are coming on board and the departments that are going to be using these tools, they feel like if we get them involved early, they feel like that they've been heard and that they've been part of the journey from the very beginning. Because the worst thing that can happen for the clinician is just being told, this change is coming, you're going to have to deal with it. But in the end, as long as each of the clinicians from all the different departments, and the speech tools will be used differently across all clinicians and all departments, but as long as they've felt like their opinions are heard, their input was put into consideration when the whole planning was done from the beginning, I think that will lead to a better and more harmonious relationship between the vendor, the clinicians, and just the overall project.
And that's really important too. And you hear that often, and you think about your own setting, about that example you said, "Well, we do things differently in this department," or you don't understand, it's just different here. And it can be easy if you've done a few where you're like, "Oh, okay, well, sure, everyone says that." But that comes from a legitimate point of like, yeah, like that's the clinician's perspective, the end user's perspective on where it is. And if you don't get that buy-in, then, um, trying to convince them through force is not gonna happen. So some of those change frameworks, or the point around listening, like you say, and trying to really understand that workflow is pretty important. And thank you, Katrina, for pointing out the actual acronym for ADKAR, and that's there in the chat too. The awareness, desire, knowledge, ability, and reinforcement. So getting those pieces in place and guiding through is important. But there's many more stakeholders in health, as we know, than just the clinicians, and particularly in a hospital and health system, like in a healthcare system, in a hospital setting, Karen, a few different stakeholders there, a lot of people to keep happy. How do you
Mhm.
keep them all happy?
Communication, communication, communication.
Yeah, yeah, yeah.
Look, I mean, it is. I mean, it's key. Communication is very key to um, all stakeholders, whether it be our clinicians, our vendors, our executive. Everyone has to be kept in the loop so that we can ensure that everyone's happy. Um, we do aim for that kind of hypercare approach in the delivery of significant tech, um, especially that change. That includes, responsiveness and understanding their business and how the technology best fits within what they're doing on a day-to-day basis, and customizing wherever possible to the individual or to those smaller groups' needs. Uh, we we try to understand individual clinicians and clinical services um, as a whole, so that we can understand how they use the technology, and what can we do and the vendor do to streamline their experience. Um, how can we tailor that tech to their needs if possible? With our current implementation with 3M, we have been able to customize and improve efficiency around, working smarter using standards and templates, pre-population of standards. So, doctors could have a standard that is a full letter or paragraph or even words that they can insert into the body of their document. And this doesn't need to be dictated every time, because they're universal. I suppose something really, really insignificant, but maybe the treatment of an ingrown toenail. So, each time that treatment is the same and the follow-up instructions are the same, but it can all be cut and paste and, not cut and paste, that template can be inserted. So it just makes everything that little bit more streamlined and easy for the clinician. Also shortcuts and, improving, individual dictionaries that are specific to services like pediatrics or, general surgical. It really improves that end user experience. So we're always looking for more ways to be able to do that. Because ultimately, especially with this particular implementation, it was about how we get those letters out to the primary healthcare providers and patients quickly. I suppose also, up front, we give them some initial training, but then we've kind of really gone with that hypercare, offering support at the elbow in their own environment. So using tech as they're working, so that we understand what it is they're doing, and what we can do to make their experience better or assist in that kind of high pressure environment. It just allows us better to understand better and support more robustly.
Yeah. You mentioned hypercare a couple of times. And from what you've mentioned, it's like being there basically next to them and they're elbow to elbow and being quite hands on. Is that that what that is like in that early stage?
Yeah, definitely. And it may seem like a significant outlay of resources, but it sets us up really, really well for light touches once we've kind of got over that initial implementation, because we've empowered the clinicians to embrace the technology and we've been there to support them through it.
David, do you find that's a consistent kind of model in other health systems that you kind of work into? Is that those that have that investment into that early piece, that hypercare component, usually yield some better results and get better buy-in?
Yeah, definitely. Because with a big change that kind of comes in your way, at least for a clinician, that's kind of the big thing that's you're thinking about that all the time. If you're used to working a specific way and all of a sudden they're introducing these new speech tools that are supposed to make your lives easier, first of all, some people may have their doubts, some people may be excited, but when that change is coming, that's fresh on your mind. So if you invest in that piece very early, so for the people who embrace that new technology, it's pretty easy, right? They're really excited about it. They have a good mind about it. They're pretty positive about the change. So those people are pretty easy to adopt because they've already had this positivity towards this change for the new tools. For the ones who are kind of on the fence, and especially the ones who are really resistant to it, um, when that change is somewhat forced upon them, you really want to take advantage of that hypercare situation, just because if you can switch, especially the ones who are kind of on the fence, to be a little bit more positive, all the clinicians talk. And that's probably your best resource in terms of adoption, having the clinicians kind of talk amongst each other and saying really good things, saying, this is what I'm doing to help my workload, or this is how I'm using the tools. Because with these tools, there's so many different features and functions. Not everyone is going to take advantage of all of them, right? We want to try and find the features and functions of these tools that are supposed to make their lives better, suitable for each individual clinician, and that's not a one piece fits all. So
Yeah.
definitely hypercare is very important from the very early in stages, and you want to invest a lot of that energy and adoption into that.
Well, that kind of ties to the point that Karen mentioned before, but also what Roy put in the chat too, where I guess if you call it the preventative health of adoption and having a good adoption experience of technology, you want to have a good understanding of the customer if you're like thinking from the vendor's point of view. But he pointed out here that or is there always challenges despite fit for purpose solutions? So yeah, I mean every healthcare setting feels like it's particularly in hospitals. I feel like no two tech implementations are the same, right? And that Karen, you mentioned the fact you've got templates and everything, but sometimes that might not be. How do you balance the fact that every um adoption is every implementation is different, but also at the same time there's probably some similarities. Um, Karen?
Yeah, I suppose, I mean, even though each implementation is different, we have key commonalities. And I suppose that's that customer relationship management again, because we can carry those similarities through every implementation, and the relationships and that understanding of what areas need and we can assist with. We can have thought about that all up front. So it definitely assists us through the different implementations. I mean, we have to do our due diligence, researching and monitoring these new technologies and asking the right questions of the vendors, knowing our clients and what their needs are. It all makes it just that little bit easier. Um, we have to look at other health services. Are they using that technology? What were their key lessons learned? Did the technology meet their expectations? Where were any necessary integrations, seamless? And how did we have that, how did those clinicians adopt and adapt in those health services? It just makes it a little bit easier, because I suppose if we can't make it easier, faster, and smoother, what is our selling point to the clinician and to our clients? Just think, there's also other things, we can ensure, that peer engagement. It's the word of mouth. I mean, a doctor speaking to another doctor or a nurse speaking to a nurse is so much more impactful than, the vendor reaching out, or even us, because we have the relationships, but that peer word of mouth is the key to really getting that adoption across the line. Clinicians respond best to clinicians. So, we identify services at the beginning that may adopt better and faster, so that word of mouth kind of gathers momentum. It's like the proverbial rock rolling down the hill collecting moss. But we also have to have leadership on board, because it if it's being driven from the top down as well. But sometimes that kind of, we need to have those really robust discussions pre-implementation to understand what their needs or thoughts of the needs are, and what key pain points may be need to be considered, so that we can have, a plan around that. Also, presentations, do your road shows, going around talking to people, telling them what's happening, selling the product. Clinicians are becoming very au fait with systems due to the constant change, and that can be a real positive, as they are adaptable and often savvy with picking up the new tech. But unfortunately, it comes with that double-edged sword, where change fatigue can be our enemy. So we really need to be thinking of everything up front, or wherever, as much as we can up front, so that we can support them through the implementation. And look, I mean, as doctors then move around the organization, all those skills that they've picked up, the knowledge goes with them. So we're just continually, keeping the ball rolling.
Absolutely. And look at that point you raised around, having clinicians and getting that buy-in from leadership, clinicians doing the leading. It ties nicely to Melissa's point, that she's seen a lot of success when health providers have a multidisciplinary team, CCIO, that's leading a change, digitally skilled clinicians leading design teams, shifting the power and control to the people who know the business the best. So that's totally aligned with what you've just said there. David, I'm thinking about, this hypercare stage where, okay, so we agree investing up front in that that adoption piece is really important, and thinking about those things, especially in this current climate of constant change and change fatigue. So if you do a half-baked implementation, then that's probably going to impact the next one, not just that particular one you're doing. Once you're out of that stage, how do you actually get out of that hypercare stage, which is not sustainable, like having someone physically there all the time? How do you go about getting to that point where you can let go a little bit and let them run free?
Yeah, so kind of what we were talking about, or what Karen was saying earlier around that peer-to-peer relationship, I think that's a extremely underrated tool that we need to really take advantage of, because typically when vendors come in, they have all the data, all the tools, all the training collateral, and you have people that are kind of spending time with them. But I can, I've been doing this for a while, and there's many, many doctors where in the beginning you approach them, I don't want to use it, I don't plan on using it, and that's just kind of the answer that they give you. It's very hostile, and it's very reactive. But when you are able to get someone that they work very closely with, especially, someone that they really respect, someone that they spend a lot of time with. And there's someone that might have been on the fence, or maybe there was someone that embraces new technology, and you're really able to get them happy. These doctors talk all the time. So when they're talking to each other, it's constant reminders of, hey, I've been doing this. This is, X, Y, Z. That's how this tool has made my life easier. This is what I'm doing for these types of reports or these types of letters that I'm doing. Why don't you try it out? And so over time, you're just kind of chipping away at a rock. And then under that rock, you might find a diamond. And when that person who kind of flips over from being very negative and kind of wants to dabble in it a little bit, we found some of these users to be some of the most successful and
Mm.
the ones who provide a lot of feedback. So that part is really good. I think that's a very underutilized tool to really focus on the champions of the doctors, kind of like what Karen mentioned, because once they are a champion, they're really engaged. And the second you get a very engaged doctor, that's where you have a lot of positive results because it's just a trickle down effect. Kind of like when, there's people always say when you go to a restaurant, it's a really great restaurant, um, and you had a good time, the food is decent, everything was good, you tend to not leave a good review. But if you have a bad experience, you typically write a review. I think it's kind of opposite with clinicians. When something is really good, they want to tell everyone. They want to kind of just yell it at the top of their lungs because we've seen a lot of these situations where doctors um, who have embraced the technology and have been engaged, they just, they're pretty much the voice for us. We probably
Mm.
don't even need an adoption team at that point because the doctors are doing all the work for us. And sometimes the good thing about this is they actually teach us cool tips and tricks as well. So
Mm.
we're supposed to be these experts, but then these are the doctors who are using it all the time, and they actually teach us this is actually a better workaround than what you've shown us, and that's that creates a very collaborative relationship. And what we're trying to do, at least from the adoption side, is that um, we don't want a relationship where doctors say, I don't want to use this, this is not for me, I really hate this. We want to create a relationship where they're saying things like, I'm working with 3M on this, or 3M and I are working on a solution. They're having their teams look at it for me. We want to create that kind of collaborative relationship, collaborative response. And I think once you're able to establish that with the doctors, then it's happy days.
I I tell my kids that it's not that they don't like broccoli, they're learning to like it. So that could be an approach. But no, I and but I can see Roy has also mentioned, like, and this is what we're speaking to right now, the how do you deal with those anti-adopters, I guess is one term, because they exist despite all of that. Karen, anything else you wanted to add to what David's mentioned?
No, look, I just really think, that short-term pain, you get the long-term gain, and whatever that is, it's about, getting out there, getting amongst it, empowering the clinicians, empowering their decision making, and if you can get that ball rolling, it just starts the impetus is amazing, because, word gets out there and it really does make a difference to the adoption.
They don't like it yet. There you go. That's as Sarah's also put it there. Look, I can see some other great questions in the chat there, but I can't believe that we've just nearly hit time. Maybe some final kind of thoughts too. We could continue to talk, but any final thoughts for I'll go Karen and then David for because it looks like we've got a good amount of people interested in this topic around technology adoption from either side. Any final thoughts? You've summed it up nicely, but
I'm done.
you're done. David?
Yeah, well, I guess my final thoughts is, with all this new technology that's kind of getting introduced, it's just getting better. It's also getting a lot more complicated. These tools were created to make doctors' lives a lot better, a lot less painful. We talk about burnout a lot. It's supposed to reduce burnout, but in reality, sometimes it actually does the opposite, I think. And so, what can we actually do to make the tools useful in a way for the doctors to actually use it in a way that they were designed for? Kind of going back to what I said earlier around with all these features and functions, you're kind of overloaded with options, right? So when you present a doctor with all these things you can do with it, and this is supposed to make your life better, but they only care. Most doctors, I would say 95% of the doctors that I work with, they only care about maybe 20% of it, right? Because everything else, maybe a little bit more, but everything else is just bells and whistles, a lot of things that maybe doctors who are really tech savvy want to kind of break and pull apart. So having this adoption team, whether it's for short term, medium term, long term, especially in the short term with that hypercare approach, just getting them very empowered to just be self-sufficient, be confident, establish that solid and harmonious relationship with the vendor and with the project teams, I think is key to just making sure that we start off with everyone being positive rather than just being reactive and hostile and going, I don't want to do this.
Yeah, yeah. David, I couldn't have summed it up better. There's some great perspectives I see in the chat there that resonates a lot as well. I'm sure we'll keep the conversation going, and it ties on nicely to some other sessions that we've got today, but we're going to have to leave it there. David and Karen, thank you so much for your time.
Thank you.
For more content and community about technology and healthcare, visit talkinghealthtech.com.